The South African National Blood Service says it has enrolled 48 participants in its study to gauge the safety and efficacy of using antibodies from people who've recovered from COVID-19 to treat those who've become infected. The service says it's targeting 600 participants, 300 in each of the study's two arms. To help us understand the study, I'm now joined by Dr. Karen van den Berg, SANBS Translational Research Unit Head. Doctor, thank you so much for your time. Now, explain how this all works. Can people who've recovered from COVID-19 actually donate their blood plasma, as it were?
Yes, thank you very much for having us this afternoon. We are very grateful for the opportunity to tell the country about the wonderful work SANBS is doing in this regard. So how this works is that once somebody has had COVID and they've recovered, we generally wait a couple of weeks for them to recover completely, get over the infection. And then we are able to collect plasma from these donors that have recovered from COVID. The plasma contains antibodies that they develop to fight the infection. And so we are investigating whether if you then give those antibodies to patients who are currently quite sick with COVID in the hospital, whether that might help them recover quicker and also to reduce the number of people who die from COVID-19.
Now, tell us exactly how this whole process will work. We know that you have identified 48 participants so far. So once they come into your labs, your hospitals, how do you then extract their plasma, and how do you then make it viable for the next person to use?
So what we've done is we started quite a while ago collecting plasma from donors who have recovered. So we have to date enrolled in that part of our study about 350 donors who collectively have made about 750 donations. And so we then partnered with a couple of hospitals across the country. So Mitchell's Plain Hospital, for example, in Cape Town, the Universitas Hospital in Bloemfontein, Livingston Hospital in PE, one of the Life hospitals in Durban. And so when patients are admitted to these hospitals and they comply with the criteria for being admitted into the study, if they then consent, obviously, that's very important. People must be fully informed about the study and the fact that we don't yet know whether this works. And if they then are agreeable to participate in the study, we then transfuse to them about 250 mils of plasma that was then collected from one of the donors. And so about half of the people who enroll in the study, and we as the investigators don't know which half it is, will receive the plasma, while the other half will receive a placebo, which in this case is saline or salt water. And then we compare the outcomes between these two groups to see whether the plasma actually made a difference in the recovery of these patients over time.
I would imagine this whole process is in line with current treatment that people that have tested positive for coronavirus or who have the COVID-19 virus is happening side by side with the treatment. Talk to us about the safety around this. I mean, we've learned a lot about safety around COVID-19, especially when it comes to a first of its kind treatment. I would imagine this is just one of them. What does it entail in terms of testing, for the correct candidate, and from a safety perspective, when you find a suitable candidate to then transfer this blood plasma to?
So obviously for us at the South African National Blood Service, safety is extremely important. So every unit of plasma that is donated is put through a vigorous list of tests where we check to make sure that there are no other infections present in the plasma. Each of these products undergo a pathogen inactivation process to make sure that anything that might be in there that could harm the participant is killed off or removed. And then when it comes to the patients that will ultimately receive the plasma, there's very strict criteria around who can participate and who cannot. The enrollment of these participants really also happens in collaboration with their attending doctors. So there are very close working relationship between the group of doctors doing the research and the doctors who are routinely looking after these patients. And so really what happens is the participants, the patients who agree to participate, will all receive the usual care that they would receive anyway in the hospital that they are at. And then they are just, on top of that, they receive then either the plasma or the saline.
All right, Doctor, we now are firmly into the second wave of COVID-19. Predictions are that this will probably be worse off than the first phase of this virus. Now, in terms of people that have had COVID-19, the likelihood of them being reinfected is quite high, we're being told, in various medical sectors. So how long of a window do you allow from the time that the person comes in and you've tested their plasma? How long of a window do you need to actually ensure that that person has not had the virus again?
So we follow, so there's this kind of research is happening in a large number of countries. My colleague Marion Vermeulen and I collaborate with the International Society for Blood Transfusion on the COVID plasma working party. And so, you know, we've learned, all of us learn from each other. And so the safety protocols that we have in place is that somebody needs to have recovered. It's only after they've had 2 negative tests or they have been completely recovered for 4 weeks that we will take plasma from these donors who have recovered from COVID. We also, every time they donate, we test their plasma for antibodies because we need to make sure that there are still antibodies present. And so that, you know, if we're going to transfuse that plasma, we need to know that there are actually antibodies in it. And so while I think there have been cases reported of reinfection, I think if you consider the number of people who have tested positive for COVID and the very, very small number of people that have been reported on potentially having been reinfected, you know, that to me is not such a big concern. And then, as I said, we only take plasma from donors who are currently still having antibodies. And it's unlikely, although we don't have definitive studies on this, but it is unlikely that somebody will develop a second infection while they still have good antibody levels.
All right, Dr. Karen van den Berg, thank you so much for your time. That's where we have to leave it for this afternoon. We'll obviously follow up after that study has been conducted.